These signs may indicate that you are about to suffer a heart attack. Stay alert. Many people, not knowing these signs, end up ignoring them. But it could be their last warning.
If you just pictured someone clutching their chest and dramatically collapsing to the floor, forget that image right now. That Hollywood version of a heart attack is one of the most dangerous myths in medicine today. In real life, a heart attack is a silent predator. It disguises itself. It waits. And by the time most people realize what's happening, it's already too late. You know what's the most terrifying sentence I hear from patients who survive? "Doctor, I didn't come sooner because I was sure it was just acid reflux." I hear that more than you can imagine, and every single time it sends a chill down my spine, because that delay almost costs them their life. Yes, chest pain is the classic warning sign, but here's what most people don't know. In diabetics, in people over 60, and especially in women, a heart attack can arrive completely disguised. No crushing chest pain. No dramatic collapse, just subtle, easy-to-dismiss symptoms that whisper instead of scream. And it's precisely those people, the ones waiting for the classic heart attack that never comes, who wait too long to seek help. So today, I'm not going to tell you what you already know. Today, I'm going to teach you how to recognize the hidden, camouflaged signals that appear days before a heart attack. Signs that millions of people ignore until it's too late. I'm Dr. Roberto Llano, interventional cardiologist. Make sure you're subscribed, hit the bell, and at the end of this video share it with everyone you love, because what I'm about to say is a red alert for anyone with risk factors, anyone over 60, and anyone with a family history of heart disease. Let me start by destroying a dangerous myth. Most people picture a heart attack like a scene from an action movie. Unbearable chest pain. Someone drops to the ground. Game over. Can that happen? Absolutely. But in real life, especially for people living with diabetes, high blood pressure, high cholesterol, obesity, sleep apnea, or already compromised arteries, the warning can come in a completely different form. A collection of vague, seemingly unrelated symptoms that show up days before the actual cardiac event. What you need to understand right now is this. No symptom should ever be dismissed as just stress, or just indigestion, or just nothing. Because what feels like nothing could be a coronary artery on the verge of complete blockage. Survivors often call it luck. I call it a window of opportunity. Recognizing these warning signs days in advance is what separates a treatable scare from a fatal tragedy. Your cardiovascular system is sending you a distress signal. The question is, are you paying attention? Let's get straight to the point. When I say non-specific symptoms, I'm talking about signs that fool even the most careful, health-conscious people. Even doctors get fooled. Here's why. The human body is extraordinarily intelligent. When the heart begins to suffer from lack of blood flow, what we call ischemia, it tries to warn you. But the message doesn't always arrive clearly, like a sharp pain in the chest. Sometimes it arrives as a whisper in a completely different part of your body. And that's exactly where the danger hides. Here are the 5 warning signs that can appear up to 3 days before a heart attack. Warning sign number 1. Extreme fatigue out of nowhere. The first major red flag is a sudden, overwhelming exhaustion that makes absolutely no sense. And I'm not talking about the satisfying tiredness you feel after a hard workout or a long day at work. I'm talking about something completely different. A crushing, bone-deep fatigue that hits you out of nowhere. You try to make your bed, you try to take a shower, and suddenly you have to stop and sit down because your legs feel like concrete or because you simply can't catch your breath. Simple. Every day. Tasks. Why does this happen? Because your heart is fighting, desperately struggling to pump blood through arteries that are narrowing and closing. Imagine trying to force water through a pipe that's slowly being crushed. The heart has to work exponentially harder just to maintain basic circulation. And to compensate, the body begins diverting blood away from peripheral muscles and non-essential organs, redirecting every available resource toward the vital core. The result? You feel utterly, devastatingly exhausted, even when you haven't done anything. If you woke up this morning feeling that way, and you don't have a cold, and you haven't been overworking yourself, that is a red alert. Do not brush it off. Do not take a nap and forget about it. That fatigue could be your heart sending an SOS. Warning sign number 2. Indigestion that isn't about food. This one is the absolute champion when it comes to fooling people. You feel a heaviness in the pit of your stomach, a burning sensation, that uncomfortable fullness like you ate an entire feast, but you only had a piece of toast. So you reach for antacids, maybe some herbal tea, and you go to sleep. And some people never wake up. I remember a patient in the emergency room, a diabetic man, who was actively having a heart attack while we spoke. He told me he'd been experiencing an unusual burning sensation in his stomach for 2 days straight. He'd been taking antacids and drinking milk of magnesia. The stomach pain wouldn't go away. When we ran the tests, it was a heart attack. Not his stomach, his heart. So how do you tell the difference between real indigestion and a cardiac warning? There's one critical clue. The discomfort worsens with physical exertion and improves with rest. You walk up the stairs and the stomach pressure intensifies. You sit down and rest, and it eases off. That is not a digestive problem. That is angina. That is your heart begging you to stop, sit down, and call for help. Warning. Sign number 3. Pain that travels to strange places. Forget the idea that only the left arm is involved. In women, and in elderly patients especially, cardiac pain loves to hide in completely unexpected locations. It can feel like a throbbing toothache in your jaw. It can feel like tightness or pressure in your throat, like something is slowly squeezing the air out of you. It can show up as a deep, dull pain between your shoulder blades, right between the scapulae, in the middle of your back. Here's the key to recognizing it. The pain doesn't get better or worse when you change position. Lying down doesn't help. Standing up doesn't help. And when you press on the area with your fingers, it doesn't reproduce the pain. But it leaves you restless, agitated, a vague, unsettling sense that something is deeply wrong. That's because it isn't a muscular or skeletal problem. It's your brain misinterpreting pain signals radiating from the heart. The medical term is referred pain, and it is one of the most treacherous phenomena in all of cardiology. If you have unexplained pain in your jaw, throat, or back that behaves this way, don't wait. That could be your heart talking to you through a broken telephone. Warning sign number 4. An overwhelming sense of doom. This one is serious, and almost nobody talks about it enough. When I worked in the emergency room at Santa Casa Hospital, I witnessed this over and over again. People who were in the middle of a heart attack would describe it. This inexplicable, paralyzing feeling that something catastrophic was about to happen. Not a regular anxiety attack, not everyday stress, something far more primitive. Days or even hours before a major cardiac event, many patients report a sudden bone-chilling anxiety, a sensation that death is close, a cold sweat with no explanation, nausea creeping in from nowhere, an almost primal alarm going off deep inside them. That's not an emotional malfunction. That is your body's most ancient survival system activating. Your organism is entering crisis mode, and your subconscious knows it before your rational mind can even process what's happening. And now I need to say something that is going to sound shocking. But it's backed by data from major cardiology societies, and it needs to be said out loud. When women arrive at the emergency room describing this sudden, unexplained anxiety, sometimes with vague discomfort, sometimes without the classic chest pain, they are significantly more likely to be sent home with a diagnosis of panic attack or stress. Sent home with a sedative, while they are actively having a heart attack. This is not rare. This is a documented, ongoing crisis in cardiac care. Women's heart attack symptoms are more subtle, more atypical, and more frequently misattributed to emotional causes. And the consequences are deadly. So if you are a woman watching this right now, please share this video, and please remember, if you have never had panic attacks in your life, and you suddenly experience this overwhelming sense of dread accompanied by cold sweats, nausea, and extreme fatigue, stand your ground. Tell the doctor, "This is not emotional. I know my body. I want cardiac testing before I go home." Do not accept being treated like you're overreacting when your heart may be in danger. This confusion between heart attack and anxiety is one of the leading causes of preventable death among women worldwide, and it needs to stop. Warning sign number 5. Silent shortness of breath. This last sign disproportionately affects diabetics, and it can happen even if you're taking all your medications correctly, even if your numbers look fine on paper. Here's the devastating truth. Chronically high blood sugar, over years and decades, systematically destroys nerve endings throughout the body, including the nerve fibers that transmit cardiac pain signals. The result is what we call a silent heart attack. No pain whatsoever, but the damage is still happening in real time. In diabetics, the only symptom of an ongoing heart attack might be shortness of breath. You're sitting on your couch, not moving, completely at rest, and suddenly you notice you can't fill your lungs the way you normally do. You feel breathless for no obvious reason. No exertion, no fever, no anxiety. Just air that doesn't seem to want to go in. That's what we call an anginal equivalent. A heart attack happening without pain, but with the full potential for life-threatening complications and death. If you are diabetic and you notice this happening, do not wait. Do not rationalize it. Do not decide it's humidity or allergies or tiredness. Go get checked immediately. Now, what do you do if you or someone near you experiences any of these warning signs? The rule is simple. When in doubt, always err on the side of caution. The cost of a trip to the emergency room and finding out it was gas is infinitely smaller than the cost of your life. There is absolutely no shame in going to the hospital and walking away with a clean bill of health. Embarrassment doesn't kill people. Waiting does. If you or someone around you shows sudden extreme fatigue, stomach discomfort that worsens with exertion, pain that radiates to the jaw, throat, or back, that inexplicable sense of doom, or unexplained breathlessness at rest, follow these 3 steps immediately. Step 1. Stop everything you are doing right now. The suffering heart needs immediate rest to conserve every ounce of oxygen it has left. Sit down. Lean back into a comfortable position. Do not walk around. Do not pace. Do not try to walk it off. The more still you remain, the less oxygen your heart has to consume, and the better your chances. Step 2. Call emergency services immediately. In the United States, that's 911. Do not drive yourself to the hospital. I know every instinct is screaming at you to get in the car and floor it. But if a life-threatening arrhythmia strikes while you're behind the wheel, you don't just endanger yourself. You endanger everyone around you. The ambulance carries the equipment, the defibrillator, the medications, and the trained personnel to keep you alive on the way there. That is not a convenience. That is a life-saving resource. Use it. Step 3. Wait in absolute rest. While help is on the way, stay as calm as you possibly can. Loosen any tight clothing around your chest and neck. Do not eat or drink anything, not even water. Your stomach needs to be completely empty in case emergency intervention becomes necessary. Regarding medication, do not take anything on your own. When you call emergency services, you can ask the operator if aspirin is appropriate in your situation. but only take it if a medical professional explicitly authorizes it over the phone. Self-medicating during a possible cardiac event can do more harm than good. And for everyone watching right now thinking, "Doctor, I don't want to ever be in that situation." Prevention starts with the simple, unglamorous decisions you make every single day. Start moving your body. Eat food that actually nourishes you. Control your blood pressure. Manage your diabetes. Get your cholesterol checked. Go see a cardiologist for a proper cardiovascular assessment. These are not complicated instructions. They are the difference between a long life and a preventable death. I genuinely hope this video turned on a warning light inside you, because if it saves even one life, it was worth every second. Don't keep this information to yourself. Share it with the people you care about. Share it with that friend who's been overworking himself for years. Share it with your mother, your father, your sister, your neighbor. You could be the reason someone pays attention to a symptom today and avoids a heart attack tomorrow. That's the message. Take care of your heart, because it never stops working for you.